Begin on all fours, hand on your ear, rotate up towards the ceiling at a nice, slow, controlled pace. Look towards the ceiling as you rotate up to help get better mobility. Repeat in the exact same position, except take your arm, place it behind your back with your palm facing up towards the ceiling, and rotate just like the previous exercise. Lie on your back with either a foam roller or a medicine ball in between your legs, and you're going to squeeze as hard and fast as you can for the desired reps. Repeat just like the previous exercise, but this time you're going to elevate your hips by digging your heels into the ground to recruit more posterior chain activation. Place a mini band around your knees, lie straight on your back with your knees bent. Pull the band outwards just to break the hip line. When you come in, be sure to not allow your knees to touch. Perform the exact same exercise, except elevate your hips off the ground and dig your heels into the ground as hard as possible. Pull your knee to your chest. While keeping that pressure pulled in, slowly extend your leg, trying to stretch your hamstring. Nice and easy, slowly over time. Try to increase the range. Do not stretch as hard as possible right away. Lie directly on your side, straighten your leg and pull up as high towards your hips as possible. While keeping it straight, try and raise towards the ceiling without opening up your body and using your back to rotate through. For part one of this exercise, drive your knee on a 45 towards the opposite side without rotating. Try to keep your hips straight as you drive on a 45. For part two, keep your legs straight. You're going to reach across towards the wall, past your opposite leg, creating a seesaw effect with your hips. You can lean your upper back as well as you reach. For part three, rotate your knee to the opposite side, pivoting off the foot on the ground. For thoracic reach-throughs, you're going to stand up against the wall, feet about shoulder width. Take one arm, try and reach on a 45 across your body, reaching towards the opposite shoulder. Then you're going to take the other hand and reach through like you're trying to shoot through and grab something. Trying to shoot your head underneath your arm. Be nice and free and relaxed, let everything rotate. After you do your feet square, you're going to do a split stance, one foot in front of the other, and perform the same exercise. Then you will do the other split stance with the other foot in front, perform the exact same exercise. For a banded walk variation, you're going to put the band around your ankles. Nice athletic position, knees bent, good posture. You're going to pull the band wide, walking forward and backwards for a duration, and then you're going to perform lateral. When performing lateral, don't let your feet touch or cross. Stay nice and comfortable athletic position with constant tension on the band. For our 3D hip flexor stretch, you're going to take one foot, step it up on a box that's not too high, that's nice and comfortable. The other foot you're going to try and internally rotate. So you're going to turn your toes inward of the foot on the ground. From there, you're going to try and drive your hips front to back for 5 to 10 reps. Then you're going to drive your hips side to side for 5 to 10 reps. Then the last portion, you're going to try and rotate both ways, 5 to 10 reps. For our 3D hamstring stretch, you're going to take your leg and place it on the box again. You're going to externally rotate your feet, so turn your toes outward. And now the same concept, you're going to drive your hips front to back 5 to 10 reps, side to side 5 to 10 reps, and the last portion you are going to rotate side to side for 5 to 10 reps. After you've performed all of these with your toes pointed out, you are then going to internally rotate your toes and your foot, so point your toes inward and perform the same concept. You're going to drive your hips front to back, side to side, and rotate. For our stationary rotating matrix, you're going to have your feet shoulder width with your toes forward and freely swing your arms back and forth, nice and relaxed. Then you're going to turn your toes out and do the exact same thing. And for the final portion, you're going to turn your toes inward and rotate the same way. For our 3D step rotational matrix, you're going to be taking steps alternating with different rotations. So for the first portion, you're going to step, rotate around hip height like you're holding something right around your hips. You're going to step, rotate to the leg that you're stepping with while alternating. After that, you're going to step and rotate away from the leg you're stepping with. You're going to continue to alternate just like the previous exercise. Again, right around hip height like you're holding something. For the next portion, you're going to take a lateral step and you're going to rotate just like before at hip height towards the leg you're stepping with, and you're going to continue to alternate. After you finish that, you're going to continue to step laterally, but you are going to rotate away from the direction in which you are stepping. So you will step one way and rotate the opposite way laterally. Continue to alternate and stay around hip height. For the final part of this matrix, you are going to open up and rotate with a step, and then you are going to rotate your upper body in that same direction. Again, around hip height and alternating, rotating step, and then rotate the upper body in that direction. After you've completed that, you're going to take the same step and now rotate the opposite direction of your upper body. So you rotate backwards, and I take my upper body and I rotate the opposite direction. Again, hands around hip height, nice and comfortable rotation and alternating steps. For our last exercise, we're going to do both contralateral and ipsilateral dead bugs using a foam roller block, either going to be opposite knee, opposite arm, or same knee, same arm, where you're going to pelvic tilt, crush the floor, while also squeezing that foam roller block so it doesn't drop, so we have extra pressure, and you're going to complete the isometric for the duration given.